chose Dr. Richland because I was referred to him by one of my favorite doctors, Dr. Sai. And he has very nice taste in furniture, and I love gold. I've heard so much about Dr. Richland, and like I looked at his work on Instagram, and I've studied what he has done and all his case studies, and I do a lot of research when it comes to surgery. So I picked him not because he looks great, but also because he's good at what he does. I struggled with my weight growing up, and you know, in the past 3-4 years, I've learned to kind of take care of myself. And I've lost all the weight, and this is, you know, I think it's my last kind of step towards, you know, feeling better. I'm hoping that Dr. Richland could help me with, you know, just feeling more confident and just, you know, kind of living my best life.
Renuvion is a minimally invasive skin tightening device. It uses helium and radio frequency to create a beam of plasma underneath the skin, and it tightens the fibroseptal network. And that's the connective tissue that's underneath the skin. So using the Renuvion device, just several small incisions are made, and then the probe's inserted gently underneath the skin, and then that device tightens the skin internally. So the recovery for Renuvion ranges between several days and several weeks, depending on the area treated and how many areas are treated. So if it's just 1 or 2 areas and it's small, the recovery can be several days, but if it's going to be a full body treatment with the Renuvion with liposuction, that can take up to several weeks for recovery. My patients, I've had very good to exceptional results with the Renuvion device, and I think it's very important with Renuvion, because it is a minimally invasive device, to have good patient selection. So I always carefully talk to my patients in the consult to make sure that they would be a good candidate for the Renuvion before using it on those patients. So most of my patients are very happy with the results, and the skin snaps back, tightens, and they're just very happy. So Kane's a great candidate for Renuvion because he has a little bit of skin laxity, and that's the term we use when the skin has a little bit of excess and is a little bit loose. So he has some skin laxity, but he doesn't have so much that skin's starting to fold down. Once you start getting that skin to fold down almost like an apron on the abdomen, then you're talking about a skin excisional procedure. So he's a great candidate because there's a little skin laxity, but he doesn't have too much.
Well, Kane, thank you for letting me part of your weight loss journey. I'm really excited for it, and I think that you're going to get really great results with the Renuvion. You're the perfect type of patient who doesn't have a lot of excess hanging skin. The skin you have, it's just a little more loose. It has more skin laxity is the term we use. And so by using the Renuvion, which is a minimally invasive device, we can tighten the skin internally and really get that skin to snap back.
Do you think it'll help with like the stretch marks and stuff?
It helps a little bit with stretch marks. That's not our primary goal, but it does help a little bit with that.
And here, this is kind of where we're going to start marking a little bit of the lateral portion of the rectus abdominis muscles. Questions?
No questions.
So we're going to do Renuvion chest, abdomen, upper back, flanks, basically the entire body there, tighten everything up.
Okay.
All right, let's do it.
Let's do it.
Here we're starting with the tumescent portion. This is where we put in the fluid that's going to protect the tissues once we start the Renuvion portion of the procedure. So we put in the tumescent wherever we're going to treat the areas with the Renuvion, and then we give it a little bit of time to start acting, and then we can start the rest of the procedure after that. All right, so this is my favorite part about the Renuvion case, I think, is activating the Renuvion. So you can see that's the purple Renuvion beam right there, and that's going to be what's tightening that fibroseptal network underneath the skin. So you can see that working right there on the device, and then or on the pickups, and then we're going to show you what that looks like when we're actually using it.